The Mississauga Academy of Medicine has a base hospital at Trillium Health Partners, which is situated over 3 sites: the Queensway Health Centre, the Mississauga Hospital site, and the Credit Valley Hospital site. This encompasses all the hospital services that are provided to the Mississauga community and its surrounding areas, encompassing a population base of over 1 million people. The students have exposure to a large children's and women's health program. There are close to 10,000 births that take place at Trillium Health Partners annually. We also have a very large surgical service that's comprised of neurosurgery, cardiac surgery, orthopedic surgery, plastic surgery, all the subspecialties, and the largest outpatient surgery program in the province.
We're a maternal center, we're a pediatric center, we're a cancer center. At our other hospital, we're also a cardiac center, a stroke center, just to name a few of kind of the highly specialized areas we have here.
We also have some experiences that take place in Brampton and in association with William Osler. The primary site for most of the clinical experiences will be Trillium Health Partners.
As being part of a faculty of medicine at University of Toronto, you are connected to one of the most well-respected, internationally respected universities or faculties in the world in terms of clinical experience, research, and innovation.
Across the Credit Valley Hospital and Mississauga Hospital, there's the opportunity to do both inpatient work and outpatient and ambulatory care. The other thing that students have a great experience with is working with physicians, not just in the hospital setting, but also out in the community in the physicians' private practices. And this is part of their outpatient experience from a clinical perspective. And the students really get a chance to see what it would be like for themselves working as clinicians, maybe out in a community setting, and really gives them good information about what they can expect once they graduate from medical school.
The patient population that will provide the clinical exposure for our students at the Mississauga Academy of Medicine is very diverse. It crosses all ages and many cultural origins.
I think the patient population that we see at Trillium Health Partners is very representative of the population in Canada and is a great experience for any medical student.
You get a chance to see what it's like to practice real medicine with real people, no matter where they come from.
The faculty at the Mississauga Academy of Medicine are enthusiastic teachers who are excited to develop a cadre of excellent physicians to be the product of the University of Toronto.
Here in Mississauga, you are actually exposed to your mentor or clinical supervisors directly. And that gives the student great opportunity to really learn about themselves, their learning style, their future career and goals.
It's an evolving and exciting time, I think, for students coming to Mississauga. At Trillium Health Partners, the Institute for Better Health is a fairly new research institute that's just growing and developing at the present time.
This institute is focused on knowledge translation and clinical application of research. This allows students a unique opportunity to be part of the developing research community here.
There will be some innovative areas of research that will be on offer over the next few years, and that we'll be excited to work in partnership with the UTM programs to develop specifically for medical student involvement.
I have had a few students over the past few years who all applied for a summer research program at the University of Toronto, and they all got funding for clinical research in my department. They were able to present their project at the international conferences, which is quite unique for medical students.
The Mississauga Academy of Medicine is situated on the University of Toronto Mississauga campus and is fully integrated into the medical community here in Mississauga and the surrounding communities. This allows for a very close relationship between our interprofessional staff at the hospital, the students, and the faculty.
as some of the few learners out at these hospital sites, we get a lot of hands-on experience and direct patient contact. So you're the one scrubbing into the surgery, you're the one catching the baby, and I think that really plays a big role in us determining what careers we want to have moving forward.
From very earlier on, they get exposed to clinical management of patients. They develop direct academic relationships with their clinical supervisors, and they get helped almost immediately to find their career path. And that has resulted in the students obtaining very highly sought after residency spots.
Medical school can be a stressful and trying time. The great community that we have at Mississauga is incredibly supportive of that and really helps you get through the 4 years.
We really get a more cohesive sense of community within not only the students but within the faculty as well. The same people that we see all the time for our seminars and our teaching. I think that repeated exposure and that kind of grouping together is what makes it really special.
Whatever your career goals are, wherever you want to go, this is the place for you where you can find the resources to achieve your goals.
The University of Toronto Mississauga is on a beautiful campus in green space, and I know the students are always very delighted when they first arrive there and see the opportunities on that campus for learning that's in an environment where there's lots of nature and trees, and actually a really nice view from the Health Sciences Complex where they do their studies the first couple of years.
I never anticipated moving from smaller town BC to Toronto that I'd be feeding deer, but that happened, and I remember thinking, like, this place feels like home.
Out at MAM, we call ourselves the Mamily, and I think that really rings true in the interactions with our faculty, with our administration, with our colleagues on a day-to-day basis, and it's definitely a great reason to choose MAM.